Alright, so we're looking at the next stuff which we'll get to discuss this morning. So this is toxic myopathies. We'll look at toxic myopathies. So for these toxic myopathies, it's quite straightforward, right? Once you define the terminologies, of course. So if you look at the word toxic, it means what? Anything that is not user friendly, right? You take into your system, you can damage a lot of things. But here we are trying to talk about the damage this can cause to the myo. What is myo? Myo are the cells of the muscle. Okay. So toxic myopathies just simply has to do with muscle disorders, and they are caused to you when you have been exposed to drugs, toxins, or any chemical that is not user friendly. Do you understand? These chemicals could actually damage your tissues, lead to weakness, lead to pain, even muscle breakdown. So the conditions are among the most commonly causes of acquired myopathies. That means you got a muscle problem, and this muscle problem you weren't born with it, so it was acquired later on in life. You understand that kind of thing? So common causes, that's like we're trying to now talk about what are the common toxins that when they get into the body they can be able to cause a whole lot of damage. So have drugs like all those statins, atorvastatin, simvastatin. Okay. We have alcohol, chronic use, corticosteroids, use it for a very long time, come up with issues. Then colchicine, alright, antimalarials drugs, antiretroviral drugs, then chemotherapy agents. Okay, that's basically drugs used in treating cancers. So symptoms is normal like any muscle issue, right? Muscle weakness, muscle pains or cramps, fatigue, creatine levels are actually shooting up. In severe cases, rhabdomyolysis. Okay, that's like breakdown of the muscles. So diagnosis, you take clinical history where you're trying to identify that okay, this patient was actually exposed to a toxin. You do laboratory tests to check out for all those enzymes that their levels should be shooting up if there's a damage to muscles. The electromyography, muscle biopsy, you also do that. So management, supportive care, like you give a lot of water, pain management, physical therapy, keep monitoring for how the kidneys are functioning, right? So just know that they usually improve better if you remove the toxin that is causing the issue. So that's what we have for toxic myopathies.